Hi everyone, I'm here with Dr. Anshu Bansal from Dallas and Fort Worth. And one of the topics I'd like to talk about today, the most important one of all, is oral care and prevention. That's our main focus at Geriatric House Call Dentistry, to keep the teeth that we have and to make sure that nothing bad happens to them and that the aides are taking care, or the caregivers are taking care of the teeth the way they would take care of their own mother's teeth or their own teeth. And sometimes they're afraid of taking care of the teeth and they use that sponge, that God forbid sponge that looks like a little lollipop that A, I'm always afraid the patient's gonna bite it and swallow it, the sponge part, and B, what does it do? You tell us, what does it do?
Nothing. It's like you're mopping a dirty floor with a dirty cloth.
Exactly.
That's exactly how that is. So it doesn't do anything. I'm going to show you a bite stick. This is called.
Don't tell them. Oh, you can tell them. No, don't tell them. When you're the patient, you'll tell them. When they're your patient, you'll tell them.
So this is foam. Okay, so you put it in the patient's mouth and rotate it, and that will keep their mouth open. You can brush one side, switch over to the other side, rotate it, and brush this side. So it's an amazing, amazing thing.
Foam, squishy, you can't hurt the teeth, you can't break a filling, you can't break a tooth, and you won't get bitten.
Yeah, and prevention is the key for everything. And for prevention, brushing. A lot of times, I would say, we use a lot of closest products. So use their toothpaste, rinse with their rinse, not water, and that will keep the teeth clean. Sometimes if I see a lot of gum inflammation, I do prescribe prescription strength mouthwash, and if you keep it clean, pain doesn't come. Even if there is a cavity, you can keep the pain away. So keep it clean, like you would keep your house clean, or your dishes clean, or your kitchen clean. Your teeth are as important. And the other thing is to keep the sensitivity out. We use fluoride. There are a lot of products we use that lasts up to, once you apply it is good for 6 months. And then there are products that you can use on your own, the caregiver can use for their patients to keep the sensitivity out and prevent any further decay.
Right. We even have a product, actually, the Admiral Protect, that lasts up to 2 years and longer. And it's like a miracle. You go in there, they think they have a cavity. It's actually a toothbrush abrasion where they brush too hard, or abfraction, which is caused by grinding. So we can make grinding guards as well to stop that. And we have products that we apply and then give you the products to keep at home. Okay, so the one important thing that we do, and it's the most important thing that we do, is teach the caregivers what to do. Yes. Because they're so afraid when the patient bites down on the toothbrush that they're gonna break a filling or break a tooth and get blamed. And believe it or not, they do get blamed. The family will say, what do you mean they broke a tooth? That never happened before. Well, they didn't used to bite on a toothbrush before. So now we have a special toothbrush called the Wayne brush that we could actually provide to the patient or give to the patient.
That's amazing.
And you can't brush too hard, and it's biodegradable, so it's amazing. So we have all of these little tricks that your dentist maybe hasn't heard of. So it's not because they're not a good dentist, it's because they don't specifically treat this population of patients, and that's what we're known to do. So oral care, prevention, pain-free patients, treating the patient and teaching the caregiver is our main focus.
Yeah.
Anything else?
Well, we do take care of our caregivers too.
That's true. We take care of our caregivers too. Sometimes we do that. Don't tell anyone, but they open their mouths and say, what about? And we're happy to do that as well. We're just so happy. This is just a great feeling to go into the home.
Yes. And take care of everybody, from a caregiver. If there is a family that's hurting, we'll see you too.
Come on over. So give us a call at Geriatric House Call Dentistry, and now you have someone in Dallas, Fort Worth, and she is going to explode there. There's such a huge need. So assisted livings, nursing homes, private families, corporations, Dr. Bansal.
Call me, please.
Call her.